If you bring this back to our patient, unfortunately, my opinion, my observation is the more we can do is considered a success rather than the outcome, which we are not going to be able to change. And so I think if we're going to change this, it's going to take more than the philosophical understanding or the thinking part of it. It's got to really take a cultural shift. It's got to be a cognitive transformation at the highest level of our leadership in our society.
You're listening to Parallax from Radcliffe Cardiology in association with makeadent.org. Here is your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. I do apologies for the sound quality. I actually have a bad throat, but that does not preclude me from recording another episode of Parallax with a very, very dear friend and colleague, which I've had the privilege to know just recently, and I'm going to introduce him now for our listenership. So our guest on Parallax today is Dr. Anavekar. Nandan Anavekar is professor of medicine at the Mayo Clinic. He's affiliated with both departments of cardiovascular medicine and radiology at the Mayo Clinic. He's a cardiologist. He has an interest in self-exploration and inner journey and self-inquiry, and that is where we both connected. He also happens to be the program director of the General Cardiovascular Disease Fellowship program at the Mayo Clinic, and is affiliated with Global Cardiology University, which is a passion project of his because he has a deep interest in education. So with that introduction, Nandan, welcome to Parallax. And I'm so glad that we actually have a chance to do this for the listenership of Parallax, because I know we've connected so deeply on so many aspects of self-inquiry and inner exploration and philosophy at a deeper level. So thank you so much for doing this for us.
No, thank you so much, Ankur. As I mentioned, this is a huge privilege for me. And again, our sort of meeting, although virtually on many occasions now, I see that as a great blessing for me. So thank you very much.
Oh no, the pleasure is mine. And I've just had the honor and the privilege to know you through some of our common, friends and connections. And obviously we've now interacted quite a bit on email, and, hopefully have a paper coming out soon in one of the high impact journals in cardiovascular medicine. So Nandan, I think I should probably begin this episode by asking you, and, we were talking offline about this, and that is in 2023, the way medicine is thought about, and the way medicine is practiced, the way medicine is innovated. Why do you think is a topic like inner exploration or inner journey or self-inquiry important for, I personally think, for every clinician and every physician to be a better advocate for their patients, to be a better clinician at the bedside, to be a better clinical investigator when it comes to clinical investigation? Why do you think inner exploration and inner journey are important topics for medicine?
I think that's a very profound question, number one. Number two, I think that the inner journey and a contemplative state of being, I think, is essential and fundamental for any human being across the spectrum of their profession or whatever they may be doing. Having said that, I think it is extremely important for a physician, because a physician is primarily involved in the care of the human being, right? And if we truly believe that the human being is but the flesh, then there's nothing that really distinguishes the physician from, for example, a mechanic that works on a piece of technology. So the question really is, something that has been with us time immemorial, right? There is a series of questions. Unfortunately, we only spend less than 1% of our time thinking about these questions. And this question is, who am I? What is this world that I, reside in or interact with? What is this potential God? And then what is the interaction between all of these factors? Now, there are resources that can help one on the journey, but the journey in itself is inward in nature. And for that reason, if we have to understand ourselves first, I think that puts us in a better position now from a professional standpoint, as a clinician, as a physician, to look after our patients. And for cardiologists such as you and I, many of our patients that we come across are at the, could be at the terminal end, of the life, and how we deal with that needs to be tempered. And I think cardiology in particular is on the brink of excessive testing and procedures, when we know that, the end point, is looking directly in front of us.
Yes. Just eloquently put, I started having these questions, asking these questions, certainly of, who am I and what is my role in this world, and what is the purpose of the interaction that I have with medicine and with this world and with patients, back in 2018, which I think was a transformative year for me.
That's exactly the year my journey began. I just struck me. It's exactly the same time it happened for me.
So we sort of were on parallel paths, and they sort of have crossed now, which I'm very grateful for. My question to you, you mentioned something, to the order of excessive diagnostic testing and excessive procedures. And, we are in this journey in cardiovascular medicine, particularly with the advent of transcatheter therapies. And, by no means, I am trying to belittle the advances technology has made and the innovation, our procedural colleagues have endured. By all means, this is all great technology, and it has tremendously helped, patients prolong lives. But, to your point of at the brink where it may just be a little too excessive, as a proceduralist myself, I've had those questions, I've had those questions, when I've gone to bed, at night, that, okay, I'm seeing this 88-year-old, otherwise frail woman, with severe mitral regurgitation. And, granted, she has some left ventricular systolic dysfunction, and we have her on guideline-directed medical therapy, which has made huge advances. But despite that, I now have this device, which, the trials have shown may offer her, benefit, as far as the clinical, the natural progression of disease or the clinical course of the disease is concerned. But philosophically, fundamentally, I've had these questions, am I really, really offering her something which is going to be, transformative for her in terms of longevity, in terms of, what she may want to do with the remaining years of her life. And I've just had those questions because, these technologies come at a price, and, sure, we have access to them and they're being covered, and, who am I to, not offer a particular therapy to a patient? And that's where the physician-patient interaction is so important. But, philosophically, I've had those questions that are resources better put in handling a disease state, which is going to lend itself anyways in a few years down the road for this particular individual, where on the other side of the globe, 7,000 miles away, there are young kids dying of hunger. And, these are important philosophical questions, and I'm obviously taking the eagle's eye view, but I wanted to get your insight into this philosophy as someone who has been on a path of, self-inquiry and exploration, how do you philosophically handle these issues? I'm sure they come up in your practice as well. Does that make sense?
It does. It does. It absolutely does. And I think that it's very important, especially for thinkers in our society, to continue to think, but without imposing their thoughts construct on those that they connect with. And I think that's extremely crucial for people in our position as physicians, because our patients depend upon us in terms of objectivity. Now, when you talk about the philosophical sort of aspect of things, I'll tell you my opinion of myself. If I'm talking about the organ, my heart is me, but I am not my heart. So I think that I am more than just the flesh and bones. But to get to that point, I think is different for different people. If you think about, for example, some of the cultures in different religions, they work on the basis of stories. Stories begin in a manner that can be useful for a wide range of audience. At the lowest level, if you tell a story to a kid, they'll take it as a literal story. So, for example, let me tell you a story that I was told when I was a kid, and it was about a Hindu god. His name is Shiva, and he has two sons. And so both of the sons were sort of wanting of their father's love, and said, "Tell us exactly what can we do to prove that one of us is the best son." And so Shiva says, "Well, the one who can, run around the entire universe and comes first, they will win my love." Okay, or something along those lines. And so one of his sons has a peacock as a vehicle and is as fast as lightning, and the other son has a mouse. And this other son, his name is Ganesha, and he's a heavy set guy. So he's sitting on this mouse. And so the first son flies away on the peacock and goes all over all the galaxies, all the universe. And this other son, Ganesha, is on his mouse, and he goes along in his very slow way. And so finally an end comes, and the first son comes back and says, "Hey, I see Ganesha hasn't even moved. And so this definitely means I must have won." And then Shiva says, "No, in fact, Ganesha has finished the task. And how was this possible?" And Ganesha went around or circumambulated his parents. And so for the kids, I think this gives the lesson about the importance of parents. Okay, so that's at one level of symbolism. But if you take it at a more higher philosophical level, the message here is that the entire universe is really within us, so to speak. But to make that jump from the more infantile sort of synthesis of the story to the higher philosophical purport takes a lot of inward contemplative assessment and synthesis. And so we cannot sort of expect this in every interaction that we have with our patients. Now, coming back to our patient, I think that it's important at a societal level that society tries to figure out what we determine as the best allocation of resources. Because as a medical profession, we are responsible for resource allocation. We are responsible for the just use of resources. And we need to take a more global viewpoint. Unfortunately, my opinion is, and this is my opinion alone, that we have sort of devolved into a very materialistic society. We measure, and all human beings do this, we measure since the day we are born. We measure people by what they have materially. And so if you want to be a success in the contemporary Western society, you should have a lot on your plate. And that is considered a success in our current society. But if you're a spiritualist and you know more about yourself, and you take that inward journey, then you would be considered a failure. And if you bring this back to our patient, unfortunately, my opinion, my observation is the more we can do is considered a success rather than the outcome, which we are not going to be able to change. And so I think if we're going to change this, it's going to take more than the philosophical understanding or the thinking part of it. It's got to really take a cultural shift. It's got to be a cognitive transformation at the highest level of our leadership in our society.
This is so deep, and it's so eloquently put, Nandan, that, you know, I completely understand where you're coming from, and I completely resonate with what you've said. But, you know, as you and I know, for someone who's practicing in the modern corporate capitalistic, you know, United States of America, how do you try to move the needle in terms of your day-to-day work with patients, your day-to-day work as a physician leader, your day-to-day work with interacting with the leadership at our institution? How do you slowly start to move the needle to it being, you know, let's look at it from, you know, the big picture point of view. Let's look at it from the eagle's eye view as to how this looks. What are we really trying to achieve? What are we really trying to do here? Rather than just making, you know, the eventuality a prolonged process for the patient and also for the healthcare system, for physicians, for the family members. How do you execute this philosophical thinking, which is very beautiful, very deep, very eloquent, on a day-to-day basis?
I think that's a fantastic question, and I think it's sort of taking the philosophy and shifting it to a perspective of practical value. Now, I think that in any philosophical study, I think that service unto others brings the best out of each and every one of us. And so I think that the best way to inch forward is indeed just to inch forward. So in my practice now, I've taken my position as program director as a means rather than the position as an end. And so I'm using the position as program director as a means to try to instill these profound questions in the fellows. I also work in the CICU. So, the privilege of the service that I try to provide is looking after patients at the end of their life. And so within the context of the fellowship, we try to develop more community engagement, programs. So, for example, we've developed a heart clinic that works with the Salvation Army Clinic, as a free service. And so what's the purpose of that? The purpose is to show our trainees, our junior trainees who only know or who have been traditionally taught about the academics of practice, but to show them that our patients have different priorities, that resources are not the same. And so the resources that we see at the Mayo Clinic building is very different from the resources that are seen in a voluntary clinic basis. And that gets them to at least begin the question about, what am I doing? Is it fair? How these resources are allocated. How can we best change the system? So that begins with that spark, that question. Secondly, in the CCU, just on a day-to-day basis on rounds, we ask the question, or I pose the question to the fellows, should we be doing what we're doing here? Yes, we have a problem with understanding the hemodynamics of a patient that's in front of us. The patient is 85 years old with moderate dementia, multi organ dysfunction or failure, and someone brings up the question: should we do a right heart cath and make an assessment for advanced circulatory therapies? And so we pose the question, should we be doing this? What is the endpoint? And at least asking the question, maybe 9 out of 10 might move in the same direction as, yes, we need to do the procedure. But if it's just that singular one person that looks at the picture and says, hey, maybe we should be doing things differently, I think that's enough, because that one person will propagate this anxiety or this question or this doubt. And that propagation itself, I think, forms the seed for change. And as I mentioned initially, I think the change has to be cultural. It has to be at a societal level. But for that change to occur, it really has to begin at the ground, and it has to start very, very slow and develop its inertia before we see a change.
This is excellent, and I'm just elated to hear what you can sort of execute at the level that you operate, with trainees. And trainees are like sponges, and they want to soak in everything that they hear, that they see, that they listen. And that is when you start developing patterns of your practice. And I think if you can develop that cognitive thought process early on, as you are getting exposed to all the greatest and the latest stuff cardiology has to offer to our patients, to take a step back and, ask yourself, yes, I have all these therapies at my disposal. Should they even be used or be prescribed to the patient in front of me? I think is an important skill set, is an important cognitive skill set, which needs to be ushered in, rather rapidly into cardiology and into everything, particularly interventional cardiology, and even advanced heart failure and cardiac transplantation. As we continue to move the needle forward when it comes to innovation and the invasiveness of what we can do to our patients or what we can offer them. So Nandan, which I think this is a very good segue into some of the work. I want to discuss some of the work that you've pioneered through the Global Cardiology University, which I think is a great concept, and that is to take the education out of the brick and mortar system and put it at a place where there is global exchange, amongst people who want to contribute and learn, as well as share what they've learned with everyone else. And I think what you and I have discussed in terms of forming a curriculum, particularly on this topic of inner exploration and inner journey, is, for someone like you to even think of having a curriculum, which, first of all, thinking about it as, like an unmet need in cardiovascular medicine, I thought was brave. And, a provocative thought. So congratulations on that. And then, but to then extend it, and take it a step further and put it, or at least try and assemble an ensemble of topics, which, you think could be shared, through a platform like Global Cardiology University was just, mind blowing to me. So do you want to talk about that to our listenership a little bit, maybe?
Absolutely. But I have to correct you there. The inspiration is actually you, Ankur. I mean, I think what has inspired the thought behind getting young trainees to think differently, to take that inward journey, was entirely inspired by the work that you've done. And I've read your articles in European Heart Journal. They're very thought-provoking. The first article that I read regarding the Gita was actually brought to my attention by one of our senior sort of interventional cardiologists at Mayo. And that's when I started following you. And then after we were introduced by a mutual friend, I got to thinking, why can't we elaborate on this and try to develop an educational platform for trainees across the world. So before meeting you, we were doing a traditional, or we have been, and we continue to work on a traditional curriculum, but with the vision of democratizing education, making a standard curriculum available to all trainees, regardless of their training program, and with an emphasis on those that have minimal resources. Now, after visiting with you, it just strikes me as natural and intuitive that we need to go beyond the basics or the mechanical part of our jobs. It's easy, I think, after some time to understand that if a valve doesn't work anymore, we need to fix it. Either we repair it or we replace it. Or if the coronary blood flow is reduced, we need to figure a way to improve it. But the fundamental part of our practice, about any original work you take that's published, the one thing that will change the p-value on any one of those published works will be the timescale. Because if you change the timescale by an amount, it'll change the p-value. And what's the importance of that? The importance of the fundamental aspect that I'm getting at is everyone dies at some point. Okay. There is one disease that cannot be cured, that has 100% mortality, and that disease is life, if you want to see it in that way. If we want to see life as something to be celebrated and to be enjoyed, then we have to take a different viewpoint. And that's where that inward journey is fundamental. Because unless we take that inward journey, we're going to be scared about life. We're going to be scared because we see ourselves as this very small, minute entity in this vast universe. However, once we take that inward journey and we see the beauty of what life is about, the fact that we are beyond the inert material that makes up this quantitative world that we're living in, then I think we can start to enjoy life. And then I truly, genuinely believe we can offer a service to the human beings that we care for, that primarily come to us with health-related issues. And I think with that introspection, we can transcend beyond the care of the body, but also provide care and care of the mind, and actually start delivering good behavioral trends within society.
Yeah, no, well, I mean, again, thank you for thinking of me, and, thank you for having the pioneering thought of putting a curriculum together through, the ages of the Global Cardiology University. And, I can't wait to get started on that project with you. And, I think for the listeners, maybe, if someone who's listening to this episode and wants to start, like if someone is really wanting to start the process of inner exploration and inner journey, what are some of the resources? And, I think a lot of our listeners are, busy practicing clinicians, cardiologists, also, fellows in training, residents, house staff, who have busy lives. I think for me, this process started when I had finished all my training and I was into my very first year as an attending physician. But for someone who wants to start early, particularly when I think you're so focused on, acquiring more and more skills and certifications and fellowships to be the best possible trained cardiologist that you can be, how can our trainees imbibe upon this journey earlier? I think so. This is it's a two-part question. Part one is, do you think trainees should imbibe on this journey? And if the answer is yes, how can they with the busy lives that they have or they lead already?
So I think that's a great question. So question one. Should our trainees, and I would extend that to any human being, should we be starting our inward journey earlier? And I think the straightforward answer to that is yes, with a capital Y, capital E, capital S. Now, I would frame this using an analogy. When is it best to dig a well to have water ready when you're building your house? Is it when you build a house, or is it once the fire starts on the house, right? So it's always best to be prepared for a crisis, so that when that crisis occurs, and all of us go through crises, that we are best prepared for it. Now, at the minimal level, what this inward journey does for us is it strengthens our mind. It steadies us, so that when, events occur, whether they are celebratory events or whether they are more unpleasant events, that we are shaken a little less. So I think that's the fundamental reason why I would advise that this inward journey begins as early as possible, for all human beings. Now, how does one, getting to the second part, how does one integrate these important, how does one start, and how does one integrate that within a busy lifestyle? And I would answer that by a very, much used quote by my by proxy teacher, Swami Dayananda Saraswati. And that is, the value of a value depends on how much you value that value, right? And if that inward journey is important to an individual, that individual will somehow find the time. The obstacles in front of that individual will start to seem smaller and smaller and smaller. I think our role as leaders and as proponents of this cognitive shift is to make available resources, to make the journey not seem as formidable, and to invite an all-inclusive sort of setup or space where people can feel safe to start the exploration. Now, for me, when I began, it was a little bit helter-skelter, because, if I, look back, it all began when I lost a friend to suicide. And then, I was expecting my son, and I started to think to myself, what am I doing? I followed all the rules, and I become a physician. I've, climbed the academic ranks. I should be happy, and I'm not. And that's where that first spark began for me. I started sort of really in a very convoluted manner, exploring all different religions. I found that all religions, Abrahamic and Dharmic, basically tell us to behave well. And then I sort of became more focused. And that's when I took the more inward approach. But that, in my opinion, required a teacher. It was very difficult and very challenging to try to navigate things by myself. I really did need a teacher. And so I went down a more traditional path. And that began that journey of study, self-inquiry, changing my behavior to really focus on ethics. I every morning I begin my day with a prayer. Every evening I end it with a prayer. And I keep a watch on myself to make sure that if somebody was watching me, would I be okay? To make sure that I'm walking the straight and narrow in terms of an ethical behavior. And that's how it began for me. It's not going to begin the same way for everyone else, because everyone else is in a different spot. And if somebody is in a spot that they are valuing their income, or they're valuing their lifestyle, or they're valuing something else in their lives, they're not going to come to this. And I think that's okay. I think that's okay. We shouldn't feel that is a failure. But if we at least open the doors and create a space where people can freely explore this avenue of their lives, I think that's moving in the right direction.
Yeah, no, I couldn't agree with you more. That I think the catalyst, right, for each one of us is going to be different. as I'm sure in 2018, it was a different catalyst for you as it was for me. But, I think there's a final common pathway. And that final common pathway is the series of questions that we begin to ask, why am I here? Who am I? What is my place in this planet? What is my role in this planet? What is the purpose of the life that I'm living? And, I think all these deep philosophical questions, I think that's the final common pathway. Now each one of us will have different catalysts that will lead us there. And I do think, this is my own, or has been my own experience, at least in the society within U.S. medicine, that I think anytime you start talking about these questions with, I think colleagues at large, I think people sort of start rolling their eyes, or they could perceive that you're off to a tangent, which I don't blame them. Like you said, people are at different spots and different parts in their lives, and but I also think that there is that critical mass within. I mean, I don't even know medicine at large. I mean, I know cardiology. There is that critical mass of people who have reached this final common pathway, and are beginning to explore the intersection of this final common pathway within cardiovascular medicine. And I think it's beautiful that journals like the European Heart Journal have paved the way for topics like these to be, published in a high impact journal like the European Heart Journal. Because I'll be honest with you, some of the works that I've written and I've wanting to get these published in like top-notch US journals has been a struggle.
What I would say though is what you've published, I would argue, is still scientific. And I think that what one thing we have to make sure is that we don't want people to believe in the inward journey. I think we want people to understand it, and understanding means that there needs to be a journey of logic. And one thing that I've found helpful is that, especially, and I think you find the same way, having gone through the journey of a very rigorous, upbringing in terms of you got to perform well at school. We've all got a scientific background, but we're understanding now life from a different perspective. And we are still utilizing the same rigorous, sort of application of logic to understand things differently. And I think that, it's very difficult to argue against the logical perspective, and we're not asking anyone to believe. And I think that's the beauty of the articles that you've published, because nobody can really argue against the conclusions that you've come to. And I think that's the beauty. I think that's what triggers that cognitive transformation.
Yeah, no, again, thanks for bringing some of the works that I've published into this discussion. I'm honored to be honest with you. But, I think where I was getting at was that there is that critical mass within cardiology where people do feel the need that these topics should be brought to the fore and discussed. And I think, people like yourself who are at, influential positions when it comes to leading a program, as the program director for, arguably one of the finest cardiovascular disease fellowship training programs, if not in the world, certainly in the country. I think you are at a great position to usher in this change and to start talking more about this topic, and to influence the future generation of trainees and cardiologists to develop and explore, and sort of build, on this field. So, maybe for the final few minutes that are left on the show. And again, Nandan, thank you so much for doing this for us. What would be your closing remarks for, trainees and, program directors and cardiologists at large, busy practicing clinicians, not only in the US, not only in the UK, not only in India. And these are our top 3 countries where, we're downloaded, but, across the globe, what would be some of the overarching messages from this conversation?
So I think the first thing is that the most easy thing when we start looking inward, the easiest thing, and I'll leave this for the contemplation of the listeners, is I would argue that we are really driven by measuring. And so ask yourselves, how do we measure? We, by looking at a person, how they're dressed, we measure them up. And no matter how we measure other people, we measure ourselves to a standard that at times may be unreasonable. So that's the first thing I would ask our listeners to do. Look inward and ask yourself, how good are you at measuring people? And I bet you're going to be surprised at how good you are. Then the next challenge is to ask the question, how important is it to measure somebody? Okay. Because by using these measuring tools, we then divide our world into a pair of opposites, into a pair of likes and dislikes, into a world of wrongs and rights, and into a world where these sort of perspectives are only but perspectives. So ask yourselves, what is the purpose of every experience that I have? Because if every experience we divide into polar opposites, a celebratory experience, everyone, enjoys that. An unpleasant experience, we wring our hands and we go on to the next experience. So the question is, what is the purpose of these experiences? And I would argue that our lives are nothing but a series of experiences, and each experience should be equated to a lesson. So whether we have a pleasant or an unpleasant experience, I think our question or our response should no longer be, oh, why is this happening to me? But what can I learn from this so that I can grow to the next level? Those would be the fundamental 2 challenges that I would have for our listeners. And then starting from that, I hope that it sparks or triggers more questions. And I hope that these seeds or these questions will evolve into more discussion. And then from those discussions, that we all learn more about ourselves.
Yeah, no, you've ended this so beautifully, Nandan. I think you've touched upon the concepts of duality and non-duality, which I'm sure you understand, but for the listenership, maybe completely new terms. So I think I would encourage everyone to look up the non-dualistic ways of thinking, which of course the Bhagavad Gita teaches, and then obviously you've talked about living from a place of equanimity, where you no longer measure your life with the number of successes or failures, however you want to define them, but from a place of what has this experience taught me, in my evolutionary path. So no, again, Nandan, this has been fantastic. This has been soul curry for me. And, I hope that it will be for everyone who listens to this when this comes out, hopefully, as soon as possible. And, I can't wait to have more such conversations with you, but thank you again for being our guest on Parallax.
This is truly an amazing privilege. And it's been an amazing highlight for me. More fun and more meaningful than the traditional talks that I've given in the past. I think this is truly important, and I want to congratulate you for all you've done. And I want to say on the record here, what you've written and our conversations have been impactful and meaningful for me. And I really, truly see it as a blessing. So thank you very much.
No, thanks again. And thank you for being such collaborative force. And, I just can't wait to work with you, more on this journey of inner discovery and exploration. But, thanks again.
Thank you, Ankur. Thank you.
We hope you enjoyed today's podcast, produced by Radcliffe Cardiology in association with makeadent.org. We aim to bring you a new angle of all things cardiology every second week. Review us on your favourite podcast app or send your comments or questions to podcast@radcliffe-group.com. To view the series, head to radcliffecardiology.com/podcasts/Parallax. Thanks for listening.